My name is Varia Williams. I define myself as an actor, a teacher, a development worker. In a former life, I used to be a lawyer. I was called to the Barbados Bar in 1999, but I don't really speak of that. And most recently, I have kind of shaken a little bit of it, or evolved, I should say, into something different. I now call myself a creative arts therapist or a drama therapist. A creative arts therapist works in the field of psychotherapy, but we use the arts and we use creativity in all of its forms. I mean, fine art, movement, drama, play, all forms of creativity essentially, and we use it as the modality and the methodology for working in the therapy. Our work is very client centered. So when you say, what are we trying to solve? It depends on what the client needs, or the patient for that matter, because some of our clients or patients have mental illness. Sometimes people come because they're confused, they're muddled, they're overwhelmed, they're stressed. They may have been diagnosed with anxiety or depression, and or no diagnosis, just feeling real low all the time and my family is getting me down, or at work I am just under so much pressure and I feel sometimes that I could burst. And so we see all kinds of clients. And what we're trying to solve, sometimes we're not trying to solve, sometimes we're just trying to assist you or give the client a space to just talk about themselves or work through some of their things. And I say talk because sometimes the work involves talk therapy, and that is a part of the work that we do. But sometimes the client requires a little bit more expressive arts, a little bit more expression and creativity, and that's the modality that we sit in and that we live in. For me, I have been a dramatist for so long. I mean, that's how I define myself. I also, at some point in my life, wanted to be a fine artist. So I love painting, I love making, I love being creative. That's my passion. It's not everybody else's passion. What we try to do with the clients when they're in this space is kind of find ways to express the thing that's going on. I might ask you, how you feeling today? And you might say, I'm feeling real heavy. I'm feeling real break up. And and I'd be like, well, let's put that in your body. What does that feel like? What does that look? And then the person's body kind of changes. And I find that when you make a shift from what is cognitive, this is how I've learned to communicate with, from brain to mouth. When you go into a shift that is a little bit more in your bones and your blood and maybe your psyche, that's when I think we're getting at the truth and getting at unraveling some of the challenges that we've expressed, that we've had for so long. Painting, play is so exciting because as adults, I think we unlearn our imagination. We unlearn how to play. Children have that in bags. And when you use play, and we use perhaps something called projective play, with, let's use a doll or an object, and we talk about this object or a character in a story. Oftentimes they're talking about what they know personally and what they think that character might be going through. And we're using this therapy in an oblique way and in an indirect way so that you're not necessarily talking about yourself. You're getting a kind of detachment from it, but sometimes you're hitting it right the nail on the head. The story is speaking to you, the song is speaking to you, the movement is speaking to you in ways that you couldn't imagine, you wouldn't have found the words for. I started in this work, my evolution into this work has been long standing because my work with Mustard Seed Productions was big in development work. We wanted to work with the young people to get them to be expressive and find themselves through the art forms. I think the thing that took me over the edge, and I mean that in all kinds of ways, was COVID. When we were brought to a grinding halt and the young people, me, the staff, parents, so many of us were in crisis. And a lot of the creatives came to the creative arts to say, well, help, I'm not okay. And I found I'm not equipped. I am not equipped enough. And I felt like, now, since we're on a halt, let me go and do this thing quickly. So I said quickly, it took me 2 years. And I went to go and study drama and movement therapy in the UK. And it is huge in the UK, it's huge in Canada, it's huge in the US. I think the Caribbean is now catching on to understand that that is an allied healthcare, a different way of looking at mental health therapies in a way that is very helpful. When I was in the UK, I worked in the NHS system. I worked in a forensic hospital. I worked in a school with young people with moderate to severe learning disabilities and difficulties. And so that was working within private and public sector as an employee, even as a trainee. And I think that's what I would love to see for the Caribbean and for Barbados, especially, where you're not just trying to hustle to see one-two clients, but you're working institutionally in a mental health field and trying to get adults and young people to kind of appreciate that creativity is healing. Creativity helps you find balance, helps you to get a little bit more discovery into self. A lot of people think that they need to be creative, need to be good at art, need to be good at dance and movement, and that is absolutely not the truth. Really, you have it. We are all creatives. And so the creative arts is certainly not about the product, not about you coming up with something beautiful or fantastic. It is about you going through the process to deal with the thing that you know is the thing. Sometimes it's about a relationship that you have that is challenging, or rather, sometimes you think it is about a relationship that you have that may be challenging, a relationship with a parent, a spouse, a child, an employer. And I think the therapy helps with a better understanding of self, a little bit more of personal discovery. And when you use the art form, you are unlocking a part of yourself that hasn't been allowed to flourish, hasn't been allowed to be expressive. We often suppress so much of ourselves from childhood, or that's too painful. So grief is one of those things that we find great difficulty allowing ourselves to be properly bereaved and to be grieving. And I think the art form gives you a space. And I say the art form, every time I say the art form, I just mean whichever one we, the therapist and client, discover together, which could be through music, it could be through drawing or coloring or expressing, putting it in your body. Poetry is another one that really helps unlock things that you could not find words for. And I think when the therapist who is trained and who understands body language and attunement and working well with the client sees this is something, we help you to dig a little bit deeper and go a little bit further in that discovery and that growth. And it's not always comfortable. And comfort means that there's change and that there is shift. And when that happens, it's a safe space where you feel held and heard and seen and taken care of and looked after. And we don't always find spaces for that.
My name is Dr. Adrian Waterman, a pain specialist in Barbados as well as an anesthesiologist. Do you know that already doctors in Barbados are prescribing medical cannabis? And in fact, that pharmacies are already distributing medical cannabis to patients? You can only use or consume medical cannabis legally in Barbados if it's prescribed by a registered medical practitioner. If you are the parent or the guardian of a minor, you must obtain in writing a certificate indicating the use of medical cannabis in the minor. You must also give informed consent for the use of the medical cannabis in the minor too as well. If you are a patient that requires assistance, you can designate a person over the age of 18 years old and approved by the courts to be your caregiver. This caregiver is going to be responsible for the administration and the appropriate dosage of medical cannabis to you, and it's also for monitoring the use of medical cannabis. And remember, if your prescription requires repeated usage over a period of 3 months, your pharmacy or your therapeutic facility cannot dispense more than a 30-day supply of individual doses at any time.
For more information, visit our website at www.bmcla.bb.
As Barbadians prepare for the Atlantic hurricane season, here is some basic information for every household. A gallon of water per day per person for consumption to cover about 2 weeks. At the very least, a 3-day supply of dry goods and canned foods. An adequate supply of prescription and non-prescription medication, along with a first aid kit. You will need to stock up on hygiene supplies like toilet paper, toothpaste, and soap. If you have a baby, you should ensure you have extra diapers and wipes, as well as any special food items. You should ensure you have flashlights, batteries, and a portable radio. At this time of year, Barbadians are advised to avoid buying excess meat, frozen foods, and other items that require refrigeration in the event that electricity is lost for an extended period of time. This would result in spoilage and a wastage of money.
Hi everyone, I'm Dr. Danielle Reed Malilo and I'm a general physician. And today we're going to talk about knowing your risk for obesity. In Barbados, overall, 2 out of 3 adults are overweight and 1 out of 3 adults are obese. Also, in children, 1 in every 3 child is overweight or obese. There are some health parameters that you should know about yourself. These parameters are your blood pressure, your HbA1c and fasting blood sugar, your weight, and your BMI. At home, you should have a blood pressure monitor, a glucometer, which is a blood sugar machine, and a scale. And from time to time, you should document these readings, and you should also be familiar with these readings. You can also take a diary with the readings to your doctor so they can better help manage your condition.
We are living in the aftermath of COVID. We're also living in the aftermath of a lot of things. I think as a post-colonial society, we're still reeling in issues related to identity, and living in the aftermath of slavery still. And I think that that means we as a people, as a Caribbean people, which is a hodgepodge in many ways of a mixed culture, a potpourri, a cobblepot, I think identity, who we are, what are our values, what do we want for ourselves? I think that's kind of where we are trying to discover it. And it's a real struggle as a small island. There's a climate crisis all around us and we are worried. And so what that looks like to me in mental health is stress and anxiety more than anything, a sense of overwhelm. And I think what we kind of need to get our heads around is to kind of breathe it out, I suppose. I mean, it sounds a little bit heebie-jeebie, but I feel like to acknowledge that that is what's happening is a big part of it, because a lot of us have been told, get on with it, keep it moving. And that is our legacy in this kind of post-colonial, post-slavery mentality. Come on, you know what my grandmother had to go through? We had to work in the cane ground, keep it moving, keep it moving. And so big part of it is acknowledge, I am not okay. I am stressed out. I am overwhelmed. And working through that and creating a space where somebody is allowed to say that and feel that and hold their belly and say, and that's me breathing that out. That is a massive start to getting through the work and finding balance and just recognizing that you're enough. You are enough. You're okay. You're in a place that is safe and you can be held. And sometimes people live in really precarious situations. Economic crisis, we are all struggling trying to stretch a dollar. And I think the therapy wants to acknowledge, yeah, so let's see how we can help you in your small society, your small community, in your family life, so that you're able to say, I need a break. When I was in the UK, I worked in a multidisciplinary team alongside social workers, psychiatrists, psychologists. And in those spaces, I think that's the best care that a client can have. And of course, that was when I was working within an institution and I had the benefit and privilege of working with an MDT. You might have been to another kind of therapist before, and it's not always one size fits all. So someone might be like, I want to go to a therapist and I don't know what's the right therapist for me. And you might want to try creative arts therapy just to see, how does this feel for me? Or you might have been to a specific kind of therapy that you like, I know that don't work for me. And that has been my experience. I've been to all kinds of different therapists. I paused just now because I believe in therapy. I believe in it as like going to the gym, finding a space where you can deal with your mental health. Sometimes you feel completely fine. Maybe you should just go to a therapist to check in, just to get a little check-in to be like, this is kind of where I am in my life. This is what I'm dealing with right now. And sometimes I find this part difficult and not. And your therapist might give you a few little quick tips and say, kind of think about this, maybe start to journal, maybe start to do these things, and you don't need to go again for the next month. Sometimes that works. For me, I was absolutely blown away when I discovered creative arts therapy, because I thought that as a creative, yeah, like how is that? But maybe it was because there were so many parts of it, so many parts of myself that I just discovered, and I had to let go of that desire to be good at the art form, which was hard for me. And then I could not believe the depths that I went to and how much suppressed things I had going on, all kinds of grief that I hadn't processed properly, all kinds of difficult relationships that I had not dealt with properly. And I am infinitely better because of my own personal relationship with creative arts therapy and finding various art forms to push past the discomfort. I think as a people, Barbadians, my people, we find it difficult to express ourselves freely and easily. We're quick to bad words, which is all right, but oftentimes that is because we ain't got no more words, man. We have a lot of rage. We have a lot of anger. We have a lot of unprocessed grief. And I remember my grandparents, if I asked my grandfather how he was, he would say all the time, poor, peaceful, and polite. And that was his mark, his mask that he would walk around saying that's who he was. People talk about Bajans being the most polite people. We talk about how we line up. We talk about how great we are in our tourism industry. Underneath that is a bubbling rage and anger that I know I have experienced for myself, not just with my people, but for me. I think that our biggest thing is how to process some of that pent up anger, rage, grief, sorrow, and sadness of things that we have had to push down from childhood, and how to be a lot more expressive. Our males are told not to cry. Our males are told not to be expressive in the body and we are people that use our bodies all day, every day, until you tell us to use our bodies, and then we don't know what to do with ourselves. And I think the creative arts really would help us to unlock a lot of that deep, dark rage that we carry, that grief, the sadness, the things that we have been told to not say and not do, and find a space where we could do it safely. If I could leave some words of advice, I would say make something, create something. Journaling is, people find journaling extremely helpful. Some people find it really stressful because they think they got to write with proper commas. But we live in a technological age, so if you don't want to journal with a pen and a pencil, you can draw and say if you could get that in artwork if you want, or text it. Write a text to yourself or the person that you always wanted to send a text to. Do things like that. But I would really just say start to make. Find a space where you can say, today I am baking a cake. Today I am gonna get a piece of clay and mold something about how I am feeling, about what happened yesterday at work that got me in a tizzy. I'm gonna see how I can express that.